Hi, good evening everyone. Today I am going to talk about homelessness and IV drug addiction in 137 Woburn neighborhood. We have made one case scenario. Case scenario is here. Mr. Michael Chan, 26 years old male, immigrated from China 5 years back. He was living in Lawrence Avenue East, Scarborough with his fiancée. Last year they broke up. After that he stopped meeting his friends and relatives. He stayed sad all the time and he couldn't eat well and sleep at night. He started to take IV drugs every day to relieve his stress and he gets addicted to it. Eventually, he lost his job and the rented apartment and becomes homelessness. One day, he woke up near a garbage bin with bruises on his face and hand. His hand was swollen and painful. He went to visit the nearby community health center, Scarborough Center for Healthy Communities. At the health unit, he expressed his desire for have a normal and better life.
Homelessness is described by the Government of Canada as the situation of an individual or family who does not have a permanent address or residence. They also stressed out that being homeless is not just merely having no place called permanent shelter. It is also the living experience of having unstable, unsafe, temporary home, or even just having no means of acquiring it. In the case of Stanhope, she categorized homelessness into three. One is the absolute homelessness. These are the people with totally no housing or shelters that they can go to. These are the people living in parks, sidewalks, or seen on the streets begging. Second is the sheltered homelessness. These are the people who uses emergency housing programs provided by the community or the government. Lastly, we have the hidden homelessness. These are the homeless situation wherein an individual or family uses their vehicle as a shelter or they lodge in with their friends. We categorize Mr. Michael Chan as an absolute homeless. There are several factors leading to homelessness according to Stanhope. 7 of these can be related to the case of Mr. Chan. First is he lost his relationship with his fiancée. He coped up using illegal substances. Eventually, his relationship with his friends and family got also complicated when he stopped talking to them. He is now unemployed as he lost his job. Therefore, he is now considered as an individual living in poverty line, which also means he can no longer rent an apartment. Also, let us not forget that he's an immigrant. All this, according to Stanhope, leads to his condition of being homeless. Based on a report from Statistics Canada published this year, more than 235,000 are homeless in Canada. 39,400 of these are found in Ontario. As displayed on the graph on the left side, it is undeniably that Toronto Central still remains the most cases with 42.8% in the year 2017. IV drug addiction. Addiction is defined by the Book of Stanhope as a pattern of abuse characterized by an overwhelming preoccupation with the compulsive use of drugs. Compulsive meaning uncontrollable. They still continue to use this despite of negative consequences. This may sometimes also be the end result of an ineffective coping mechanism, as some individuals use this as an adaptive response to a condition or a situation, like in the case of Mr. Chan. Contributing factors can be classified into 3. One is biological factors, for example, is age and gender. The Canadian Association for Mental Health reported that men have higher rates for addiction than women, and young people aged 15 to 24 are more likely to experience substance use disorders than any other age groups. Second factor is psychological. On the same article, it is stated that people with mental illness are twice as likely to have substance use problem compared to the general population. Lastly, we have socio-environmental factors. These are the conditions in the community that leads to the use of substances. For example, is poverty, low income rate, and homelessness. On the same article, it is said that various Canadian cities indicate that between 23% and 67% of homeless people report having a mental illness, which also leads to the substance abuse. A paper published by F. Lane said that almost half of Canadians in 2017 have reported that they have used illicit drugs at some point in their lives. And also, one report said that 1/4 or 23% of Toronto homeless adults reported using IV drugs. The census data displays several risk factors that may predispose the Woburn neighborhood to having homeless population and substance abusers. For example, there is a high poverty and unemployment rate in Woburn. Despite these worsening conditions, prices of houses and rental fees are continuously rising. When accommodation prices increase, the more it becomes unaffordable, especially to those people living in poverty line. The higher possibility of becoming homeless. Homelessness can cause mental health issues that may increase the likelihood to people reaching out for unhealthy stress relieving options, specifically illicit drugs. The data findings and analyses are very much helpful for community health nurses to develop a well-organized plan of care.
Stanhope and all have provided the details on how to build a trusting relationship with your client. It is a very important initial step for community health nurse before doing nursing assessment. Firstly, create a trusting environment by following what you say you will do. Show respect, compassion, and concern by listening carefully to your client. Assess each person and don't make any assumptions. Know about all the resources that are available in your community. Coordinate services and providers. Advocate for accessible healthcare services like neighborhood clinics, mobile vans, and home visits. Focus on prevention by teaching the client about preventive healthcare at every opportunity. And community health nurses should develop their own support network because working with vulnerable population can be challenging.
Has been using morphine IV substance to distress. His medical history, he has no history of chronic diseases and he has no known food or drug allergy. His mother had depression. He has been using illicit drug for 1 year. Family history: broke up with fiance last year, lost job and rented apartment 6 months back. Subjective data: he denies having any suicidal ideations. He reports having lost weight and his clothes are loose. He has decreased appetite and unable to sleep in the night. He complains of pain in his hand 5 out of 10. Objective data: he has 1 bruise on his right cheek. He has tooth cavity and pain. His right hand is swollen and there is tenderness. Range of motion of right hand is weak. His clothes are dirty and torn. Multiple needle marks in the antecubital side of both hands.
Assessment tools. According to NIH, there are several assessment tools that can be used in assessing the patient depending on what type of substance and the age of the patient. These are the tools that can be used for Mr. Michael during the assessment. Number 1 is the TAPS. It is a combination of screen and brief assessment commonly used substances, eliminating the need for multiple screening and lengthy assessment tools. This can be done either self-administered directly by the patient or as interviewed by the healthcare professionals. Second is the NIDA drug use screening tool, Quick Search. This tool guides clinicians through a series of questions to identify risky substance use in their adult patients. Number 3 is the opioid risk tools. It is brief, self-report screening tools designed for use with the adult patients in primary care settings to assess risk for opioid abuse among individuals prescribed opioids for treatment of chronic pain. Number 3 is CAGE 8. It is an adapted version of CAGE alcohol screening questionnaire that includes drug use. If the person answers yes to 2 or more questions, a complete assessment is advised. It is popular for its usefulness in a variety of settings with a range of target populations. Number 5 is Drug Abuse Screening Test, or the DAST-10. It is a 10-item questionnaire was described to provide a brief self-report instrument for population screening, clinical case finding, and treatment evaluation research. Also, for homelessness, service prioritization decision-assisted tool, and vulnerability index service decision assistant tool, is used for Mr. Michael. This was to develop a brief survey that can be conducted quickly to determine whether a client is a high, moderate, or in a low acuity. Nursing diagnosis. Here are some of the nursing diagnoses that suited for Mr. Michael. We have the depression and substance use disorder, impaired activities in daily living, chronic low self-esteem, self-care deficit, spiritual distress, imbalanced nutrition, less than body requirements related to insufficient dietary intake. We also included the ineffective individual coping related to personal vulnerability and lack of social support, and the deficient knowledge related to lack of information.
Nursing plan and intervention. According to your nursing assessment, prioritize Michael's needs. Firstly, provide treatment for the hand injury and follow up with the investigation reports. Screen for depression and provide referral to the mental health care center. Refer him to detox and drug treatment centers. Refer him to shelter, food bank, and clothing resources. Provide wound care treatment as needed. Screen for infectious diseases like hepatitis B and C, TB, HIV, AIDS, and STI. Refer for dental care services. Provide referral to a social worker who can further assist for health insurance coverage, affordable housing, free legal services, social work assistance, and subsidies. Provide counseling and education. Enroll him in job training and job searching program. Take informed written consent. Provide needle exchange program or other harm reduction strategies as required.
Nursing planning and intervention. Provide services according to his needs, psychotherapy, group therapy, support groups, cognitive behavioral therapy that allows patients to learn new coping skills, medication to minimize cravings and reduce withdrawal symptoms, involved in recreational activities and programs, skills in order to better cope with cravings and stress, holistic method that treats addiction with intervention, addressing the body, mind, and spirit such as yoga, meditation, art and dance therapy, animal therapy, massage therapy. Advocate for policy programs such as Educate Housing, community outreach services, and preventive health services.
Strategies. Build a collaborative relationship with the client to develop realistic and attainable plan of care. Help client identify his needs and ability skills through discussion. Involve client in decision making. Work resolve clients' identified barriers to treatment, lack of transportation, social support, poor literacy, nutrition, and social stigma. Encourage verbalization of feeling, fear, and anxiety. Provide support for the decision to stop substance use. Strengthen individual coping skill. Facilitate learning of new ways to reduce stress. Provide information about the prognosis and treatment needs. Promote family involvement in a rehabilitation program. Provide culture competent and culture sensitive approach. Teach self-care strategies. Provide comprehensive services and one-stop shopping. Use harm reduction strategies.
Here is the legislation and subsidies for the IV addiction and homelessness people. Enforcing legislation is one strategy used in primary prevention. These are mandated to help in controlling the continuous rise in homelessness and IV addiction cases. Number 1, general assistance aid provided by the federal government includes aid to families with dependent children and the food stamp program. Number 2, social security, old age benefits and disability benefits for those with specific qualifying disabilities. Number 3, federal housing law. Number 5, section 504 Rehabilitation Act. 5, McInerney Act. It provides rental housing assistance at homelessness persons with disabilities, especially persons who are seriously mentally ill, have chronic problems with alcohol, drugs, and both, have AIDS and the families of such person. This MC Act has so many programs such as supportive housing program, safe haven demonstration program, shelter plus care program.
The local resources found within Woburn community. The first one is the Community Health Center, located at Scarborough Center for Healthy Community. Eligibility for service is one must be a resident of Scarborough. Services available are mental health, primary care for adults, harm reduction, clinical counseling, and cognitive behavioral therapy for insomnia clients. Rapid Access Addiction Management Clinic caters to walk-in clients that requires access to support and services without any doctor's referral. In this clinic, they do assessment of substance use disorder and review treatment options. They do overdose prevention education and provide take-home naloxone kits. Families for Addiction Recovery is a charitable organization founded by parents with children who struggled with addiction. They provide parent-to-parent support, counseling, and advocate for families. Canadian Mental Health Association is a charitable organization that promotes mental health for all. It is a community-based health agency that developed programs to support individuals with mental health issues. Few of the services available are housing, family support, and community support program. Lastly, AGATA Resource Center Incorporated is a private practice that aims to provide awareness and support through mental health education. It caters to youth, immigrants, blacks, parents, and caregivers.
Resources or external partners for homeless. Reaching Home. It is a community-based strategic plan developed to prevent and reduce homelessness across Canada. Home First. It is a Toronto-based private charity program that provides services for housing. Homeless Hub, also known as the Canadian Observatory on Homelessness. It is a web-based research library and information center devoted to homeless Canadians. Toronto Central Line.ca. It's an online-based hotline center that people can go to find for available housing in their community. Toronto Emergency Shelter System and Winter Services Plan for people experiencing homelessness. It's in Toronto-based. It's delivered through a network of city-owned and leased facilities in collaboration with community-based partner agencies. Resources or external partners for substance abuse. Finding Quality Care in Canada by Canadian Centre on Substance Use and Addiction. This is a drug and alcohol treatment material guide that provides information regarding drug and alcohol abuse. Health Canada Substance Use and Addiction Program. This program provides contribution funding for time-limited projects that address drug and substance use issues in Canada. Center of Addiction and Mental Health, CAMH. They have services that includes assessment, brief early intervention, residential programs, day treatment, continuing care and support, and family support.
Nursing evaluation. Community health nurse should evaluate Michael's perspective and adherence to the care plan. Reassess the effectiveness of mutually agreed care plan continuously. Use evaluation to adjust the existing care plan. Follow up Michael after referral to ensure that desired outcomes are achieved. Community health nurses need to know that it's often difficult for clients like Michael to return for follow-up. However, she can teach him self-care strategies for evaluating outcomes. Here are all the references for our mental health presentation. Thank you.